And now, to close out our general sessions, Facebook's head of healthcare research, Dr. Freddy Abnousi.
In America, we lose far too many lives to completely preventable disease every single year. In fact, if you look at heart disease and cancer alone, we lost 1.3 million lives last year. And we know how to prevent this. As clinicians, as healthcare, we know that so many of these lives lost are completely preventable. And preventable through fairly standard clinical care as derived by amazing organizations such as American Cancer Society, American Heart Association, American College of Cardiology, and the CDC, who have spent decades developing guidelines through research and analysis. And this should be available to everybody across the country. But despite this, we know that millions of Americans every single year do not get the potentially life-saving preventative health care that is right for them. And it doesn't impact everyone equally. If you are disadvantaged from a socioeconomic perspective, the evidence suggests that you will likely be disadvantaged from a health outcomes perspective. And this is why on Monday of this week, we released the preventive health tool at Facebook in collaboration with our amazing partners, the American Cancer Society, American Heart Association, American College of Cardiology, and the CDC, focused on preventive health for heart disease, cancer, and flu. The goal here is to take the amazing clinical wisdom that exists from decades of work in these amazing expert organizations, and in a consumer-friendly way, deliver that to the pockets of our users, all of them, so that they can engage with this information on their own terms. We released in English on Monday, and we'll be releasing in Spanish in the next couple of weeks. And they can be empowered to be their own health advocates and the advocates of their friends and families and communities, driving the conversation in America further towards prevention, transitioning from treating people that are ill, sick care, to preventing them from getting ill in the first place, health care. As a practicing interventional cardiologist, I could not be more excited about this. So let me show you what this thing looks like. So you go to Facebook mobile and you type in preventive health, and what comes up is the tool. You click on that and it gets you to the tool itself. This is a pretty simple tool. And at this point, all we ask for is your age and sex to deliver to you the tailored recommendations from these expert organizations. And from this point, you really can do only about 5 things. And these 5 things are done in order to decrease the barriers that we know impact engagement in preventive care. So first, you can engage in information. We spent a significant amount of time on this particular part to make sure this information that comes from decades of clinical wisdom is digestible and actionable. Second, you can mark something as done if you've already had it done. You can also set yourself a recommendation, or you can share the tool, not your tailored recommendations, but the tool itself with your friends, family, and communities. And we believe that this is how healthcare transitions, by driving health through the community, empowering people to become their own advocates. Thereafter, let's walk you through when you engage with the information. You can see here on the screen is the cholesterol test. You can see here is the marking and done, setting a reminder. All of this is meant to drive dialogue with primary care. Now, we also know that not everybody in America has access to primary care. So we've built a map, again, trying to decrease the barriers to getting preventive care, and overlaid federally qualified health centers across the country on this map. The reason we've chosen federally qualified health centers is because they're everywhere, including underserved populations. Additionally, by mandate and mission, they are treating whoever walks in through the door, regardless of their ability to pay, their insurance status, or the type of insurance that they have. Let's take a minute to talk about privacy. As a practicing clinician, I couldn't be more keenly aware of how different health is compared to everything else, how different health information is compared to everything else, and we believe we should treat it differently because of that. So let me summarize for you what we've done to do so. Firstly, whatever recommendations you follow through on, we never ever see any of your tests or test results. That is between you and your provider. Secondly, your use of the preventive health tool is not visible to any other Facebook users. Thirdly, the limited data generated by this tool is not shared with any organizations. In fact, it's even restricted to the number of Facebook employees that have access to it, just to keep it functional. And finally, any information generated from this tool is free from advertising. Now, of course, if you click on the American Heart Association site and like their page, that may go to inform ads, but anything you do within the tool itself is free from advertising. With that said, let me take a moment to bring on some of our amazing partners to discuss further transitioning from sick care to healthcare in America, focusing on prevention. Maybe they're not showing up. All right. To save some time, I'm going to jump into introductions while they walk up. You'll find Dr. Deepti Ichapuria from the American College of Cardiology, Dr. Laura Makarov from the American Cancer Society, Dr. John Brownseed from Boston Children's Hospital, and Dr. Eduardo Sanchez from the American Heart Association. All right, folks, thank you so much for joining me up here. I'm going to start with you, Laura. You're a primary care practitioner and a leader at the American Cancer Society. Why did we lose 600,000 lives to cancer last year?
Yeah, that's a great question. Thanks for the question. So there's so many answers to that question. We've lost so many people to cancer. We're expecting 1.7 million new cancer cases this year. And like you said, 600,000 deaths this year. Yet many of the most common cancers, breast, colorectal, lung, cervical cancer, can be prevented through screening and other prevention efforts.
So we have preventative measures. They're standard, but they're not getting to people. Why do you think that is?
Yeah, another great question. There's so many barriers that people face. We've got barriers with access to care overall, which you mentioned. People don't have access to primary care. That may be because of geographic barriers to where our providers are across the country, as well as financial barriers, insurance barriers. And then when patients get to us, we don't always have time to go through all of the recommended prevention tests that are needed. In my own practice, I'm a leader in prevention and early detection of the American Cancer Society. I'm a family physician. I believe deeply in the power of prevention, and yet I know that my patients aren't always getting the tests they need. When they come in with urgent issues or acute things we need to address, we just run out of time. Despite my best efforts, despite my electronic health record reminders and pop-ups, we just often run out of time.
Dr. Sanchez.
Yes.
From the American Heart Association, are there differences in why you guys can't reach enough people for prevention? Why I, as a cardiologist, and why Dr. Ichapuria, as a cardiologist, continue to treat acute heart attack patients? Why can we not do more for prevention?
I think the comments that have already been made are some of the reasons. One, access to care, but maybe more importantly, knowing that somebody's got a condition. So 30 million, roughly 30 million people in the United States have high blood pressure. Significant percentage of those do not know it. Roughly 10 million people have type 2 diabetes, that includes type 2 diabetes. Many of them do not know it. And roughly 25 to 30%, 30 million people have high cholesterol. Also a significant percentage, 25 to 30% do not know it. Why is it important to know those things? Because those three conditions, which are A, easy to detect, easy to treat relative to lots of other things, are keeping us from keeping 650,000 people a year dying from cardiovascular disease, roughly 125 to 150,000 people a year dying from strokes, and then another 80,000 people dying from type 2 diabetes. Do the math. That's a lot of people whose deaths could be prevented if we could connect with people, make them aware of how important it is to know blood pressure, cholesterol status, and glucose status, and then do the things that need to be done to get those controlled.
Dr. Chapuria, does this affect people equally across the country?
Absolutely. I mean, I think that what Eduardo said is true. If we can do all the simple things for prevention, we can prevent people from coming in with heart attacks in the middle of the night. I mean, Freddy, you know, getting called at 2 o'clock in the morning for somebody that's having a heart attack, I would much rather see them during the daytime and then do the prevention work that's necessary. It's simple steps that can make a huge difference. You know, if you exercise on a regular basis, 50% cardiac mortality reduction just from exercising 30 minutes, 5 days of the week. That's a simple recommendation. And I think that we need a better way to get these basic prevention recommendations out to the public. And I think that the tool really lets us to get to the very large number of people that really need this information to sort of lead better, healthier lives so that we can impact the care of the people that we've been trying to impact for a long time.
John, let me ask you, we lost 80,000 people to flu last year. We have a flu shot.
Yeah.
Why?
Yeah. I mean, the reality is that the vaccine is like our greatest public health invention, yet we're still at immunization rates that are under 50%. It's not because people are morally opposed. You know, we've done surveys, there's a recognition that the vaccine works, but not necessarily for them. And so there's an educational problem and there's an access problem. So getting people to understand that they're actually recommended for the vaccine is incredibly important. But then from there, how do you start to identify where to actually get the vaccine? And because we've been talking about this issue of access, not everybody has direct access to a vaccine in the primary care setting. And so of course, there's huge numbers of other locations, right? Pharmacies and other types of clinics that if you could start to aggregate that content, build a tool like we've done with the Vaccine Finder, but then use a channel like Facebook to get that out there, all of a sudden you can really start to move the needle in immunization.
John, how long have you worked with the CDC to get this information out?
So we've been working with the CDC now since the H1N1 pandemic, where it was, there was a mad rush to get the vaccine, and there was a real need to identify places that had issues around vaccine availability. Since then, we've been running this site, but we get 100,000 visits a year. I mean, that's really just not even any measurable difference from what we could get with a much larger opportunity and platform.
Thank you. Eduardo, can you tell us a little bit about your experience in Texas in trying to roll out prevention?
Sure. A couple of things. One, federally qualified health centers. I learned to be a doctor in federally qualified health centers. And the opportunity that presents for those who are uninsured or underinsured, this platform connecting people is tremendous. But you and I were talking earlier about when you can put this information in front of folks and help them to activate, you can make a huge difference. I ran the state's health department in Texas for 5 years. And one of the things that I was able to do was use workplace wellness platform to make it possible for people to pursue prevention. And I was telling you earlier, just to cut to the chase, the number of emails that I got where the subject line was, to me, "You saved my life," because I was given credit for having led this. It was a team effort, made it all the worthwhile. Those are the ends of one. Those were the stories that are really memorable. But the data that we collected, the numbers of people who got the right kind of preventive screenings that they needed to get and who were put on the appropriate medications that they needed to get, was all captured with data. And it was absolutely the right thing to do. So AHA has no reservations about this platform delivering to an audience that maybe we haven't traditionally been able to reach, to give them information and activate them and have them engage with their primary care docs to get the preventive services that they ought to get based on age and sex.
In America, we know that if you're lucky to live in Colorado or California, your life expectancy is 85. And in certain counties in Mississippi, you're expected to die at the age of 65. Heart disease and cancer are the leading killers in America, the leading causes of death in America. How can we impact the disparity in health outcomes through prevention? Open it to the floor.
Well, I think number one, trying to get this information out to all different, diverse populations. So if we can reach those people in Mississippi to get the message out. I mean, look, the American College of Cardiology's vision has always been to have innovation and knowledge improve cardiovascular care and outcomes. But we've had a lot of tools, we've had a lot of materials, but we've had a hard time penetrating and getting out to some of the populations that really need it. So if we can find an innovative way to get the message out to these people, at least it starts with first getting the message and then next acting on it. But I think that even though we've had a lot of educational materials, a lot of people haven't gotten the message. So, and this is something they can do at home. It's on their fingertips because they can put in the information and they get now trusted information. The American Heart Association, the American College of Cardiology has collaborated over 40 years to develop clinical guidelines based on research. So we've translated research to guidelines that you can use to improve your health. Now, how do we get that information to individual people to make a difference in their lives? And hopefully these types of innovative approaches is what we need.
I would say the same for ACS. The knowledge is so important to empower patients with the right knowledge that they know what screening tests they're eligible for and what intervals to have the screening tests done. Yeah. So much of it is complicated, right? We have breast cancer screening, colorectal cancer screening, cervical cancer screening, lung cancer screening if you've been a current or past smoker, and lots of other lifestyle factors that we can modify and reduce our risks about. But patients just aren't always aware or don't know. So reaching a broad audience in places that we can't get to through social media and other places is great. Patients trust the internet for all kinds of things, unfortunately sometimes. So we are excited about providing trusted information to help people understand which screening tests they're eligible for, and then to go speak with their personal provider about that.
Freddie, let me add. Yes. Never mind, it's important, never mind that there's the differences in life expectancy across states. There's differences in life expectancy across cities. Yeah. And in cities like New Orleans and Chicago and others, there's as much as a 15-year difference in life expectancy in folks. We might be able to we might be able to ask questions and come to understand the reasons why. But I do think that the great thing about this platform is it is a way to address what I think should be a morally objectionable reality. It should not be the case that in the same city, in the same state, or in the same country, there's this kind of difference in life expectancy that could be eliminated, and preventive care would be one of those elements. Yeah. And if we did the things that the platform can do and took it to its optimum, we could measure a reduction in life expectancy differences in the United States of America.
Absolutely.
The reality is, I mean, patients aren't going to their local public health site or they just don't know to go there. You know, why not build tools where people actually are and explain to them in ways that they know what to do next? This is all about trying to actually meet the patients in the digital world where they exist and then try to bring them into the real world to do the important things to help themselves.
And Freddy, you know, education is at the cornerstone of prevention. I mean, anytime you talk about prevention, everybody says, oh, it's all about educating them. We need to get the information out to the patients that need it. Well, we've been doing that for how many years? This is what we've been doing. And we haven't been as successful as we want, just given the statistics that we've been talking about. So we need to find novel, innovative ways to get the information out. And how better than to have trusted information from organizations like ours that gets out on a platform and hopefully can get to those people.
Educate, empower, and activate.
Exactly.
Get people to take action.
Right.
As a person who came up in federally qualified health centers, I love the fact that this is something that is going to serve people whether they have insurance. If you have insurance, you still probably need to go see the doctor and get some things taken care of. And if you don't have insurance, here's the place where you can go. I live in a state where that's critically important. One of the things that drives those differences in life expectancy between the states you talked about is the degree to which there is access to care for people who are uninsured. This is at least one way to give people information, activate them, and then tell them where they can go for care.
The other thing is the information on this platform, this trusted information, if they do go to one of those federally qualified places or their own doctor, they have information to start a conversation. We want to have a conversation with our patients because that's the best way to impact their health. So they need some basic information to have that conversation. We want to do patient-centered care, but what does that mean when the patients don't have a good basic understanding?
We've seen screening rates stagnate for most of the cancers that are screenable. Very little change in the past decade. Some small change with colorectal cancer screening. Breast cancer screening rates have been just stagnant for the last decade. So we're not reaching all the people that need to know that breast cancer screening can save your life. Colorectal cancer screening can save your life. Just recently, I was speaking with a patient about colon cancer screening. I happened to have time that day, and they were really reluctant to have a colonoscopy. We talked about stool-based testing as an option. They had that done. It was positive. They needed a follow-up colonoscopy, had that done, had a polyp removed. In that case, we prevented cancer. Removing that polyp prevents cancer, and that happens patient after patient, neighborhood after neighborhood, community after community.
So I think this gets us to the information itself. Let's talk about guidelines, how these are derived, and why these are the recommendations you all made for Facebook to put down for heart disease and cancer and flu.
So I'll just start by saying we are partners with the American College of Cardiology, that is the American Heart Association and the ACC. We use a very rigorous process for developing guidelines, which involves what's called a systematic review of the literature. So a group of experts comes together, but a group of technicians, I would say, do the work to curate the science that's the most up-to-date science. That science is not only, it's not all looked at the same way. There's some science that's better than others. There are methods to figure that out. All of that is curated, all of that is evaluated, and all of that turns into a set of recommendations, some of which are very strong recommendations because the evidence is very strong and the opportunity to make a difference is strong. And then there's other recommendations that are don't do this because the evidence is you shouldn't do it. And I think the important thing is that everything on the platform, at least from the perspective of ACC and AHA, all guideline-based. You can find the science. It is relevant, current, and extremely valuable to make a difference in people's lives. But it's a rigorous process. And oh, by the way, when people say, yeah, but last time it said this and this time it says that, that's because science evolves and we learn new things. There was a time when people thought the world was flat, and then they figured out it wasn't. And that happened from maybe one day to the next. Those kinds of things happen where new science has us rethink our old assumptions.
And I think of guidelines as taking the clinical research that tells us what the best thing and then translating into actionable items. I mean, what should we do? What are the recommendations based on science?
Yep.
And it is a rigorous process, but I think it's about taking that next step, like you were saying.
Similarly, ACS follows a similar rigorous scientific process with a systematic evidence review, which is then guided by experts, consultants, patient advocates, and we get a lot of feedback that we take very seriously from our external stakeholders when we review the draft guidelines and finalize.
So what I know about guidelines is that you all set them and they're meant for clinicians to practice off of. In this case, your guidelines have been made more digestible and actionable and given directly to the pockets of all of the Facebook community. And our hope is together we can empower, activate. Did I say that right?
Yes, sir.
And get people to be their own health advocates.
That's correct.
Thank you so much for joining us today.
Thank you.
Thank you.
Thank you.